verify is my scene safe. I will check for if it's a MY or NY, my number of patients, if I need any additional resources, if I need to take ceasefire precautions. I will then go into my general impression. I will look for AIDS, sex, race, CC, CTC, LOC, any major clues and position. In this case, I found my patient supine, about 22 years of age, of East Indian descent, and she's a female. She doesn't seem to be in any distress, does not look sick. Then I will check my patient's level of consciousness using the ACT2 scale. I will check my patient's orientation by asking her some questions if she's awake. I will then go into my ABCs. I will check my patient's airway, making sure it's open, clear, and maintained. I would open it using a jaw thrust and make sure it's clear via suctioning. I would maintain it either using an OPA or NPA. I would then ask the questions, is my patient breathing and how adequate? I will test adequacy using SOI-PASO. I will check my patient's SpO2. I will inspect for tracheal deviation, jugular vein distension, decap BTLS, and rise and fall. I would see if my patient needs oxygen by a BPM1 nasal cannula. I will then palpate my patient looking for tracheal deviation, jugular vein distension, from C3 to C7 looking for step downs and point tenderness, subcutaneous emphysema and decap BTLS, coming across the clavicle, praying hands, feeling for rise and fall of the chest, and then coming under the arms. Then I would auscultate mid-clavicular left and right, mid-auxiliary left and right. I would see if my patient has any sucking chest wounds, any penetration, any punctures. Then I would reevaluate my patient's SpO2. I would then go to circulation of my patient, which is pulse, skin, and bleeding. I would check to see if my patient's pulse is strong or weak, rapid or slow, regular or irregular. I would check my patient's skin, color, temperature, and condition. I would check to see if my patient is bleeding, obvious, hidden, or internal. Then if my patient shows signs of shock, I will treat my patient for shock. I will treat for shock with position, oxygen, warmth, and ALS. After I check circulation, I will go into disability. I will check my patient's Glasgow Coma scale and check her pupils using Pearl. I will then make my transport decision, and in this case, I will load and go. After that, I will do my secondary assessment, which will be a rapid body scan. I will be palpating my patient's head, her ears, her eyes, her nose, by her mouth. Then I will be feeling for tracheal deviation, jugular vein distension from C3 to C7 for point tenderness, and step downs for subcutaneous emphysema and decap BTLS, coming across the clavicle, coming down in praying hands, feeling for rise and fall of the chest, coming up under the arms. Then I will be palpating my patient's abdomen. Then my patient's pelvis. Then sweep. Then I'll be checking my patient's legs, PMS on each leg. Then I'll be checking my patient's arms and PMS on each arm. Then I'll turn my patient to her side and I will walk down her spine, looking for step downs and point tenderness, then sweep. Then after, I will take my patient's history using sample. I will then take my patient's vitals. After this, I will address any injuries I did not address at the beginning, anything that needs to be splinted or bandaged, etc. Then after this, for a stable patient, I would assess them every 15 minutes, and for an unstable patient, I would reassess every 5 minutes.